Hey everyone, quick video response to Witchontherocks Pmdd video. PMDD is premenstrual dysphoric disorder. For me, I've never been officially diagnosed with it, but I do believe that there were times in my life that I probably did have it. Because for me, I'd go from happy and smiley, and then it would be like happy, and then I'd be like two different people, completely, miserable, and just, it was bad. But I have to say, for me, in recent years, that thankfully I don't have the problem of PMS anymore. I've since about 6. I'm sorry, I don't have a calendar. I think it's about 5 or 6 years ago. I was diagnosed with endometriosis, and I had a cyst about the size, as they said, of football, and they don't know how I live with it. They said it was there for about 5 years or so, and it was bad. I had emergency surgery. I almost died because I have a small frame as it is, so it kind of was the way it was growing. It was growing upward, and it was like maybe, as they said, it was a few inches close to my lung. So if I would have waited another month, 2 months, it probably would have ended up crushing my lung at some point. For me, I can say that, thankfully with my endometriosis diagnosis, that, almost immediately when, I started the medications to treat it, I immediately didn't have any symptoms of PMS anymore. It was great. For me, I've pretty much, you name the drug, I've pretty much tried it. Recently, what I've done for the past about 2 years or so, I've done Lupron Depro, which pretty much is a drug that's used for prostate cancer, that when used in endometriosis, it will prevent the growth of cysts, try to shrink the cysts that are already there, and after taken for about 3 months, it will cease to stop the cycle, which is great for me. The only really main issue that you have with that, if you take it continuous, which you're really not supposed to, for most people it's usually about a 6-month mark, and then you're supposed to stop, use a different form of treatment, and then, if you need to go back, you can. If you're going to continue to take Lupron longer than 6 months, you're supposed to be on some sort of form of add-back therapy, which is either your progesterones, your Fosamax, your biophosphates, to keep your bones from deteriorating. That's really the biggest thing. When you're losing your estrogen levels, you need to keep your bones at bay. You need to keep your bones healthy, and so for me, it's really not a choice, because I'm not at the point in life where I want to go backwards and, go back to be living in pain every day, go back to being miserable. I don't want to go backwards. So for me, taking Lupron and doing a biophosphate with it works for me. It doesn't really help, the level of my bone density, really. It doesn't make it any better, but it keeps it at bay, so it's really not getting any worse. I know on the other side of the coin, you have, for any of you that have polycystic ovarian syndrome, you have the Depo-Provera shot, which I think, as I said previously, it will keep your progesterone levels at higher, so that way, even if it doesn't stop your cycle, it will at least keep you from developing cysts in the future. For most people with polycystic ovarian syndrome, the key is to keep your cycle continuous, because for most people the cycle is usually scattered, and that's how cysts develop. And I lost my whole train of thought. So, for most people with polycystic ovarian syndrome, that is the top form of treatment. Then obviously you have the pill, and then you have nothing. And obviously, for any of us with polycystic ovarian syndrome or endometriosis, the key is to keep your fertility functionable. You want to, so do the best that you can to keep the menstrual cycle at bay so fertility issues don't cease to get any worse as years pass. And, for me, I mean, that's, what I've been trying to do. I've done, freezing of the eggs, a couple times. I mean, twice for me, I think, is at the point, I'm going to go, because can't really afford much, beyond that. I mean, it really is just, an expensive thing. Insurance does not cover it. So for me, if, the eggs that I froze at that point, if they're not going to be viable, then, for me, then, at least I could say, in my future, when I do go to do, IVF, when I get married, so on and so forth, at least I could say I tried. At least I could say, you know what, I did the right thing. I try to preserve what I can. And if it ends up, when I do IVF in the future, if it ends up not working, then it ends up not working. But at least I'm not going to look back and say, you know what, I should have done this, I should have done that. So at least I'm not going to look back on it, on regret. And obviously, freezing the eggs is not an easy process to go through. Obviously there's a lot of complications involved in it. It's not something that I recommend. I would recommend it to anyone as a point of, obviously, like, last resort. If you don't have any other choice and you want to make sure that you'll be able to have a child in the future, then I say go for it. But it's not something, like you see on TV sometimes, you have these thoughts, oh, I'm just going to freeze my eggs because I want to go have fun and drink and party and have kids later on in life. For those people, to me, it's just like, you're being an idiot. You're putting your life in danger. You're putting, obviously, your unborn embryos, you're putting them in danger, because there's no need for you to freeze your eggs because you want to have a kid later on in the future. I don't like that. And then you have people that obviously, are infertile for whatever reason. They're trying to have a baby and they're trying to do things the right way, and, they're going through all the cycles of IVF and it's not working and it's not working. And, these poor people have to resort to, adoption and donor eggs and donor sperm and yada, yada, yada. So, I don't really, the people that kind of do it because they just want to start their family at 40, to me, I just think that that's ridiculous, that you would put your own life in danger for stupidity. Because you wanted to go out and have fun and so on and so forth, it's like I said, it's not something that I recommend to do, but, if you're in a situation where your fertility is not that great, then obviously the sooner you freeze your eggs, or the sooner that you do an IVF cycle, the better. Obviously, as when they say, you hear in the movies with your biological clock is ticking, obviously, I mean, we know that that's true. We know that there's a certain point where, even for regular people that don't have fertility issues, that your fertility is going to start to decline. And usually they say that at 30, that's the point. That's kind of the point of where the fertility and the quality of the embryos will start to decline. And obviously, I really haven't spoken much about PMDD in this video. I've kind of really gone off on a tangent, and that's not what I was looking to do. I was just pretty much going along with what Sammy, Witchontherocks, had said, and she's, 100% right with everything she said. PMDD is something that, that affects your life in a way that will inhibit your relationships and inhibit on how you function in day-to-day life when you're affected with the PMDD during those few days before your cycle. I don't necessarily believe in Cymbalta and antidepressant drugs work for PMDD, because if you still have your hormonal imbalance for whatever reason, even if it's not due to fertility issues, you're still going to have that hormonal imbalance even if you're taking Cymbalta. So if you're not on some sort of hormonal medication to keep you balanced and you're not being watched by a physician due to your hormonal imbalance, what's the Cymbalta going to do? If you have raised estrogen levels or lowered estrogen levels, or you have raised progesterone levels and low estrogen levels, or raised progesterone levels and raised estrogen levels for us people with endometriosis, then what's Cymbalta going to do? You still have double the amount of estrogen than the regular person who doesn't have endometriosis. So How is Cymbalta going to help you PMDD? It's not. What you need to do is obviously balance your hormone levels and lower your estrogen levels, so you don't have the anti-estrogens in your system, developing into a cyst later on in the future. Okay. Well, that's pretty much my piece, and I hope everyone has a good day. All right, guys.